The Commonwealth learning more about the Bahamas' response to the COVID-19 pandemic from the Prime Minister. Good evening, I'm Jiminita Swain. Welcome to the Bahamas Tonight, the National Report. Thanks so much for joining us. Topping the news tonight, Prime Minister the Most Honorable Dr. Hubert Minnis was scheduled to join his Commonwealth colleagues this week to attend the 2020 Commonwealth Heads of Government meeting in Rwanda, Africa. However, that changed to a virtual meeting due to the global COVID-19 pandemic. Under the theme, Sharing Solutions in Challenging Times, the Prime Minister used the opportunity to specifically outline how his government prepared and continues its response to the COVID-19 pandemic. Altavis Munnings reports.
The COVID-19 pandemic has literally hit the majority of the Commonwealth. And to start his address at the 2020 Commonwealth Heads of Government virtual meeting Wednesday, Prime Minister the Most Honorable Dr. Hubert Minnis made it clear that the Bahamas has not recorded any new COVID-19 cases for the past 10 days in Nassau, 41 days on the island of Grand Bahama, and 35 days on the island of Bimini, with no COVID-19 cases on any of the remaining 23 major islands. He also confirmed the Bahamas recorded 11 COVID-19 deaths, a limited number of hospitalizations, and adequate intensive care unit beds over the course of 99 days. Prime Minister Minnis indicated that the Bahamas government adopted a different approach in the initial stages of preparing for the COVID-19 public emergency with greater complexities, including identifying additional health facilities, repurposing those facilities to manage positive cases, while providing a safe environment for healthcare professionals. While revealing that government approved $4.5 million for the COVID-19 health response, the Prime Minister did admit that government was challenged with the supply chain of swabs, chemical reagents needed for testing, and personal protective equipment. He also said, though, that the Bahamas continuously revised protocols and adjusted guidelines to fit resources, notwithstanding that the limited appropriate supplies decreased ability to scale up community testing. And the Prime Minister credited the Bahamian people for adhering to the national curfews and lockdowns as a part of the country's success in sustaining the current COVID-19 measures. With the current decline in cases, the Prime Minister told the Commonwealth the Bahamas still has a lot to learn from the COVID-19 pandemic. He cited characteristics that the country's epi-curve demonstrates the turning or bending of the curve, as the age profile of the cases and deaths do not necessarily follow global or regional patterns, and disproportionate rates of healthcare workers contracting the virus. He also specified that the Bahamas continues to carry the distinction of being among the highest burden countries for non-communicable diseases, which impacted the COVID-19 experience. The Prime Minister outlined that 50% of the COVID-19 cases with one or more comorbidities required hospitalizations, compared to 29% of patients with no comorbidities required hospitalizations. 71% or 44 cases with no comorbidities did not require hospitalization, while 42.9% of the patients with one or two comorbidities who were hospitalized died, while 0 patients hospitalized with no comorbidities died from COVID-19. And all COVID-19 related deaths in the Bahamas occurred with patients having one or more comorbidities. The Prime Minister continued that as the 2020 hurricane season is now underway, he implored the Commonwealth to not relax efforts to combat climate change. Altavis Munnings, ZNS Network News.